Hi, my name is Dr. Rajen and I'm the lead cosmetic dentist here at the Yorkshire Dental Suite. And today what I thought I'll do is give you a little bit of information about what I generally talk about with my patients when they're coming in for the first time, or maybe after we've done some Invisalign treatment and we're discussing ways to improve the shape of the teeth and the colour of the teeth. So typically what we use is composite bonding, and that's essentially like a white filling material that's used on the front of the teeth to give an improved shape to the teeth, and that can be to the edges to line up the edges, and they're called edge bonding, or more typically across the front of the teeth as well, and that's composite veneers. So when we're placing composite veneers, we can place it in a way which is very minimal to the tooth, so we need to do very little drilling or to no drilling of the natural teeth. And then when we're placing porcelain veneers, sometimes there's a little bit more preparation required to actually get those onto the teeth. Now, a big misnomer that people have regarding porcelain veneers is that they'll shave all your teeth down and turn your teeth to little pegs in order to get them on. And a lot of that is stemmed from things that we see online, Daily Mail, Katie Price getting her teeth done, and actually getting crowns in Turkey. So when we're talking about porcelain veneers, we're not talking about porcelain crowns. The veneers are little shells that go onto the front of the teeth, and they can be done in a way that requires minimal to no preparation of the teeth. Generally, the amount of preparation that we'd do for composite veneers is the same or very similar as we'd do for porcelain. So your teeth still look like teeth at the end of the day. Now, what would lead someone to go for porcelain rather than composite? So generally what it boils down to is longevity. So composite lasts about 3 to 5 years before we may need to consider repolishing it or redoing the material, and that would involve removing the material and then replacing it for like. Now, that's fine for some people, but some patients come in with quite severe staining of the teeth, quite bad cracks, maybe some pre-existing porcelain crowns and veneers on other teeth that are going on. So as part of the decision to restore and refresh the smile, what we can then do is place porcelain work across the full smile, and that will just give us more longevity. So rather than replacing it every 3 to 5 years, we can then replace it every 10 to 15 years, which is how long porcelain generally tends to last for. Porcelain also doesn't stain, so it has a glaze layer on it, like a ceramic plate. If you imagine, if you eat some soup on a plate and you put it in the dishwasher, it comes back clean because it's got that glaze layer on it. And that's what porcelain has, so it doesn't stain over that time. And that as well is a big benefit for some patients who are wanting a bit more of a brighter white smile, because composite generally drops by about half a shade to a shade over a 6 to 12 month period. So there's a few factors in place when we're deciding whether to place composite or whether to place porcelain. And for some of my younger patients, sometimes we'll place composite just to give them that time to see how they like their new smile without committing to something like porcelain for the long term. And this will generally be patients who are quite young, maybe in that kind of 18 to 25 range, who want to get a bright white smile. And that's something which they can probably see themselves for the next 3 to 5 years having. And then as they hit 30, then we can then look at porcelain to do what we were achieving with a composite, but maybe toning down the color, going for a bit more of a natural look. But it gives you an opportunity to really love your smile in a composite material, and with composite as well, it's about half the price of porcelain, so that is often a deciding factor when going through the treatments at the clinic. So I hope that gives you some information about composite bonding versus porcelain veneers. It's really just the tip of the iceberg really, and coming in to see me, having a consultation and discussing the exact plan with yourself specific to your needs is the next step forward that I'd recommend. So I look forward to meeting you, and hope that's been helpful.